Hello all. Are you extremely afraid of being judged by others or being watched by others? If you do so you may have the social anxiety disorder or the so-called social phobia. And social phobia, it's not the normal shyness that we all do have. It's actually a mental health condition that's characterized by irrational and intense fear. That irrational and intense fear actually make it very hard on you to continue your life. It will put more and more social and psychological burdens over your shoulders, so you will be moving very, very slowly. The social anxiety actually, it is treatable, and that condition can be managed biopsychosocially, so you will be back on track. And it's very, very important to put that condition under a psychological microscope just to highlight certain facts and certain issues and the way that we do manage that condition. So if you think that you may have the social anxiety or the social phobia, it's very okay to consult your doctor. So when having to perform before others, people with social phobia tend to blush, sweat, tremble. They tend also to have the mind going blank. And actually they will have rigid body posture, and they will feel very as locked in actually, and their eye-to-eye contact will be very poor. As well, they will tend to speak in a very, very low tone. Also, people who suffer from social anxiety will be self-conscious before others. They will always be afraid of being judged, and they always will be embarrassed before others, and especially, of course, before people that they don't already know. And people with social anxiety will have also a kind of stomach pain, gut pain. They will have more and more nausea before others, and they will feel actually in a state of unrest, physically, psychosocially. And they will also do a kind of, very weak neuromarketing before others. That will affect their social life, that will affect their occupational life, it will affect their educational life. So all in all, they will feel bad. Social anxiety disorder actually runs in families, but no one knows for sure why do certain family members have the social anxiety while others not. Actually, it's a biopsychosocial illness. There's biological entities which actually involve certain chemicals and neurotransmitters in the brain, and also we have psychosocial psychosocial entities. Maybe sometimes we may have underdeveloped social skills. Sometimes misreading of others may contribute to the formation of social anxiety. Sometimes the social feedback, the negative social ones, will contribute to the formation of social anxiety disorder. So it's a biopsychosocial illness. There's a lot of research that's going on now to understand the true nature of social anxiety, and that will make us more and more able to understand and to highlight the psychological microscope over it. And finally, we can contribute more and more in the perfect management of the social anxiety disorder. Social anxiety disorders also usually starts during youth in young who are shy or very shy. And actually, it's not uncommon. It affects around 7% of the young Americans. So at the end of the day, it causes a lot of burdens to the psychosocial system generally. And without treatment, actually, social anxiety disorder can last for many years. And by saying so, it will affect the quality of the life of the client who's suffering from social anxiety. Some people with social anxiety don't have anxiety in social situations actually, but instead they will have the performance anxiety. That's say when you perform before others, let's say the sport activities, let's say the work-related activities, the social activities, you will have a lot of physical symptoms actually. That physical symptoms is a crucial and essential part for differentiating social anxiety if we do understand the comprehensive and the overall context of that formation. So it may cause you just physical symptoms, and that physical symptoms sometimes are hidden actually under a lot of other differential diagnoses. So again, highlighting the microscope over this condition is very important. Actually, the roadmap, but finally we can handle a lot of psychological needs. And at the end of the day, they will be more and more able to control their life, and they will be more and more able to be more fruitful and productive in their life. So if you have anything related to social anxiety, if you have extreme shyness, just go and consult your psychiatrist or the mental health supporting team in your area. So back again, how do we manage social anxiety disorder? Generally, we do exclude other organic entities that may mimic the pictures of social anxiety. We can ask for certain lab tests. Sometimes we ask for radiological investigations, the structural and the functional radiological investigations. Sometimes we ask for the positron emission tomography, for example, to exclude certain brain issues. And at the end of the day, we do biological interventions, psychological interventions, as well as social interventions. Biologically, we do prescribe certain anti-anxiety agents, the short-acting ones, the intermediate, and the long-acting ones. Actually, all depends on the clinical status of our clients. Then we go in psychotherapy. We do CBT, IPT, we do psychoeducation, supportive psychotherapy for the client and the others who surrounding. Sometimes we put the client in a support group and we ask him to speak before others just to raise his self-confidence. At the end of the day, he can fly and he can do his speech before others at school, at work, at the university, at the public climate, wherever he wants to speak before. That is a very important story because we need to be very patient. That story will take time. So being patient is something very, very important actually to tackle the social needs and psychological needs of clients. And, after that, we can be back on track. We can perform in a more productive and more fruitful way. So if you have social anxiety, if you have extreme shyness, if you do not know how to perform well before others, if you need to do kind of, self-management, if you need to do kind of management for social skills, sometimes being, under the expected level of social skills will cause social anxiety. Sometimes having negative social feedback will cause you more and more, let's say, confused, and you cannot perform well before others. So that story is very important, and you need to take care of. And you need also to raise your awareness regarding your mental health status. Be safe and take care.